Hi, I'm Mike Garner, president of Northwest Zoopath. Northwest Zoopath is a specialty practice that specializes in the pathology of non-domestic species. Our lectures today are on the infectious and non-infectious diseases of reptiles. First slide, please. We'll start with bacterial infections. There are a number of distinct bacterial entities in reptiles. And this slide lists a number of these entities, which we will discuss in more depth. Mycobacteriosis is common in reptiles and caused primarily by Mycobacterium chelonae, Marinum fortuitum, and occasionally avium. Other saprophytic mycobacteria are sometimes found in these lesions. Mycobacteriosis is associated with wasting, and also there are occasional acute presentations of mycobacteriosis. Typically, the gross lesions are white tan nodules in the viscera, and the microscopic lesions are discrete granulomas, and organisms are usually numerous in the acid-fast stain slide. At the gross level, the organisms, or the lesions rather, are small, nodular white foci in the viscera. Generally, the lesions are smaller than the granulomas that are seen in mycobacteriosis in mammals. These are some granulomas in the hepatic parenchyma of a snake, a granuloma on the serosal surface of the intestine in a snake, some coalescing granulomas in the spleen of a snake, and a more extensive manifestation of granulomatosis throughout the liver in a snake. These are transverse sections of formalin-fixed bone in a lizard showing extensive granulomatous inflammation or large granuloma formation that effaces the long bones and extends into the surrounding soft tissues. A granuloma in the vertebral column of a lizard associated with compression or extension of the granuloma into the vertebral column and compression of the cord. Salmonellosis is also occasionally seen in reptiles. Salmonella infection in reptiles is very common. There are many carrier conditions, especially in iguanas. Zoonotic disease is occasionally seen. Development of clinical disease in reptiles is not well understood. Why these animals are carriers that suddenly develop clinical disease and pathologic changes is not well understood. Typical presentations include enteritis, sepsis, granulomatosis, and arthritis. Salmonella arizona is a particularly common isolate in cases of vertebral osteomyelitis in snakes. A typical presentation of necrotizing enteritis due to salmonellosis in an iguana, a pseudomembranous or ulcerative and necrotizing mucosal change, frequently will extend through the wall into the serosa and be associated with septicemia. Bilateral orchitis in a gecko, from which salmonella was isolated, and an abscess involving the nose of an iguana, from which salmonella was isolated. Pulmonary manifestation of salmonella septicemia, marked discoloration, red discoloration of the pulmonary parenchyma, and also some yellow-tan nodular foci or mottling associated with granulomas in the pulmonary parenchyma due to salmonella. This change is not pathognomonic for salmonellosis, and many bacterial infections will produce a similar, if not identical, gross presentation. Culture is necessary to differentiate the organisms that cause these conditions. Histologic appearance of salmonellosis is similar to that of other bacterial septicemias in reptiles, generally granuloma formation, a core coagulum of eosinophilic and cellular debris surrounded by a zone of macrophages and multinucleate giant cells. Occasionally there will be some heterophils and mononuclear cells in these granulomas as well. Frequently there will be thromboemboli or thrombosis in large blood vessels and subsequent fibrinoid degeneration of vessel walls. And although there are no pathognomonic histologic changes associated with salmonellosis, occasionally we do see an interesting form of cellular embolus in the capillaries of the lung and in the sinusoids of the liver, in which large numbers of histiocytic cells will be present in the capillaries. And this we see more often with Salmonella than we do with other bacterial septicemias in reptiles. And if all we had was just a liver or lung, it would be easy to overinterpret this or misinterpret this as a tumor embolus of a myeloid leukemia or histiocytic sarcoma. So it's important to assess this change in conjunction with the rest of the tissue changes in the animal. Vertebral osteomyelitis is very common in snakes, associated with fusion of the spine, and there will be variations in the histologic appearance of the acute and chronic lesions, which can lead to the early misdiagnosis of Paget's disease. Paget's disease is a disease of bone remodeling in humans and has to do with the mosaic pattern of bone remodeling that occurs in the vertebral bodies. In reptiles, the mosaic pattern of bone remodeling is a normal finding and should not be overinterpreted as Paget's disease. In bacterial osteomyelitis, Salmonella arizona is a common isolate, but other bacteria can be isolated as well, including Clostridium, Streptococcus, Corynebacterium, and a variety of coliforms. Typical presentation of snakes with advanced cases of ankylosing spondylitis due to bacterial osteoarthritis is deformation of the spine, which can be appreciated in this image, and sometimes an inability to straighten the body due to fusion of the spine. The radiographic appearance is that of bone proliferation and ankylosis in the vertebrae, sometimes extending short distance into the surrounding articulations of the ribs. Sectioning of the vertebrae reveals ankylosis or fusion of the vertebrae, areas of granulomatous inflammation or necrosis, also sometimes involving the ribs. On the articular surface of the vertebra, irregular proliferations or necrosis of the cartilage and a fibrinous exudate in the corresponding articular surface of the condyles. It's important to realize that the vertebrae of snakes do not have discs that separate them and instead have a ball and socket joint, and this is referred to as the condylar joint. This is a boiled segment of normal vertebrae in a snake, and this is a boiled segment from a snake with advanced stages of osteoarthritis due to bacterial infection. Note the marked bone proliferation and fusion of the core of the spine. Histologically, marked proliferation of bone in the chronic lesions. This is mostly reactive bone in various stages of remodeling. Also granulomas in the more active portions of the bone, generally occurring within the marrow cavity and extending into the cortices and into the joints, but occasionally bacterial infection can start in the joint. And when the granulomas extend into the spinal column, they can be associated with compression or obliteration of the spinal cord and subsequent posterior paresis or paralysis. Early stages of bacterial infection in the bone marrow are associated with acute necrosis and fibrin deposition involving the myeloid elements. A Giemsa stain of an early focus of bacterial infection and associated inflammation in the body of the vertebra. The stain accentuates the colonies of bacteria surrounded by a zone of inflammation, and already there is some reactive bone formation circumscribing the granuloma. Pseudomoniasis is an entity in pythons and is associated primarily with pneumonia. Now, Pseudomonas has a number, this is predominantly Pseudomonas aeruginosa, which is an organism with a number of virulence factors. However, the disease is generally considered an opportunistic infection associated with underlying disease processes such as immunosuppression or stress. Possibly there are some underlying infectious agents involved in this Pseudomonas pneumonia that we haven't characterized yet, such as mycoplasmas or viruses. But Pseudomoniasis or Pseudomonas aeruginosa is a common isolate in the chronic smoldering proliferative pneumonias of pythons. The typical presentation is illustrated in these slides. Normal lung is a sac-like structure with a honeycomb appearance on the inner surface. This honeycomb appearance corresponds to the air exchange regions that are termed faveolae, which are the reptile equivalent to the mammalian alveoli. In Pseudomoniasis and similar bacterial infections, there is marked discoloration, mottling, proliferative change occurring within the alveoli, generally due to the formation of an inflammatory cell exudate that plugs the faveoli and is associated with proliferation of the mucosal epithelium. Mycoplasmosis is an important bacterial infection of desert tortoises and gopher tortoises, and mycoplasma is a somewhat common isolate from the nasal cavities of clinically normal chelonians of other species. Affected tortoises are typically so-called bubble blowers and have a bubbling exudate coming from the nose. Sometimes they also have conjunctivitis and respiratory difficulties or dyspnea. An exudate is often found in the nasal cavity and nasal sinuses upon sectioning of the skull, and the histopathology is a non-suppurative to exudative rhinitis, conjunctivitis, tracheitis, and occasionally pneumonia, particularly when there's secondary bacterial infection superimposed on the mycoplasma infection. Diagnosis can be by serology, histopathology, and electron microscopy. PCR is also used now for the diagnosis. The typical gross presentation of mycoplasmosis in a tortoise is that of unilateral or bilateral nasal exudate and sometimes nasal bubbles, as seen here. Chlamydiosis is a distinct entity in reptiles. Chlamydophilus pneumoniae is the agent in snakes. There's also a chlamydia infection that occurs in mariculture reared green turtles, and chlamydiosis has been described in Moorish tortoises as well. Diagnosis is by Gimenez stain in conventional histologic sections, immunohistochemistry, electron microscopy, PCR, and gene sequencing. In contrast to the disease in birds in which chlamydia infection is typically necrotizing and acute inflammatory processes, in reptiles it is more of a granulomatous disease. It typically involves multiple viscera, particularly the heart, the gut, the spleen, and the lung. These are sections of the heart showing discrete granulomas in the myocardium. This is a section of intestine with a discrete granuloma and a higher magnification of the granuloma, showing predominantly histiocytic cells surrounding a coagulum here that is actually degenerative cell debris admixed with organisms. But as with all chlamydia infections, the organisms are primarily intracellular in these animals. Gimenez stain showing the prominent magenta granules that correspond to the chlamydia inclusions in the cytoplasm of the cells. Immunohistochemical reaction showing a positive reaction for chlamydia in the liver, also in the granuloma here from the lung, and the typical elementary and reticular bodies in the electron microscopic examination typical of chlamydia. Dermatophilosis is occasionally seen in reptiles, particularly lizards and tortoises, and has a characteristic hyperkeratotic dermatitis. We also see visceral abscesses in the tortoises associated with dermatophilosis. Diagnosis is by cytology, histopathology, and culture. These are the typical plaque-like lesions seen in the skin of reptiles with dermatophilosis. These in the neck of a tortoise, and these in the skin of a chameleon. This is a tortoise with the plastron reflected to show a granuloma in the coelomic cavity in the corresponding surface of the carapace, or plastron rather, in which dermatophilosis is involved. This is a visceral manifestation of a primary cutaneous disease, if you will. Histologically, dermatophilosis is a hyperkeratotic and hyperplastic disorder involving the epidermis, but also serocellular crusts that often have large numbers of organisms. Dermatophilosis in reptiles differs somewhat from that in mammals in that the organisms in the lesions oftentimes are more filamentous or undulating than the typical boxcar-like tracts of organisms seen in mammals. So it is important to culture these lesions to be sure that that's dermatophilous. A relatively new disease has been recently characterized in uromastyx or spiny tail lizards, and this is caused by Dermabacter, which is a somewhat obscure cutaneous human pathogen from the tropics. This disease, it causes chylitis and periocular dermatitis in uromastyx. It is a disease that waxes and wanes and associated with secondary bacterial infections. It is a difficult disease to eradicate, and it is somewhat common in the uromastic colonies that are bred for the pet trade. This is a normal, handsome uromastyx, and these are the early stages of the Dermabacter infection, in which there is a crust forming on the mucocutaneous junctions of the oral cavity. A little bit more advanced manifestation in which we're beginning to see some crusting and ulceration on the lips and some periorbital involvement. Head-on view of the same lizard, showing this typical pattern. Histologic section of the epidermis with a typical lesion. There's some hyperplasia of the epidermis, usually a linear zone of necrotic cell debris and heterophils, some edema and exfoliation of inflammatory cells into the edematous areas, degenerative changes in the keratin. And a tissue gram stain will show large numbers of organisms in the degenerative keratin layers. They're predominantly gram-positive. They're filamentous or undulating, and often in short chains. The electron microscopic appearance of these organisms, the undulating appearance and the septae. Abscesses and granulomas are very common findings in reptiles, and a variety of bacteria are involved. And it's not at all uncommon to have mixed infections within an abscess. And these can not only have mixed infections of bacteria, but oftentimes there will be, sometimes anyway, there will be bacteria admixed with fungal elements or parasites. These abscesses and granulomas are commonly seen in the viscera, the skin, the eyes, the oral cavity. And it's important to do gram stains, acid-fast stains, and fungal stains on these granulomas to be sure that you're not missing pathogens. Even when bacteria are readily apparent in the histologic sections, it's important to do stains that will determine whether there's concurrent gram-positive and gram-negative infections, or whether there's gram-positives, gram-negatives, and fungal agents involved. And in some cases, it may be prudent to also do a Gimenez stain to check for chlamydial infection in these granulomas. This is a chameleon with a periocular abscess, a three-toed box turtle with a ocular abscess, bilateral ear abscesses in a box turtle, multiple cutaneous abscesses in a gecko. Generally, a presentation of this nature is not due to a primary cutaneous bacterial infection. Instead, these abscesses represent a cutaneous manifestation of a septic process. An abscess in the nose of an iguana, in this case, probably due to previous trauma. Oral abscess in an iguana, probably due to a previous episode of trauma. Now, in the chelonians, we oftentimes will see shell lesions, sloughing of the scutes, discoloration of the scutes, or loss of the scutes. And these conditions are oftentimes misconstrued as primary shell diseases, when in fact, we don't see too much primary shell disease because the keratin layers of the scutes are so thick that they're impervious to most pathogens and environmental irritants. And what we do see is degeneration of the scutes or sloughing of the scutes or pinpoint foci within the scutes due to cutaneous manifestations of septic processes or infarcts in the underlying dermal bone that cause the scutes to slough. In this particular illustration, the scutes have sloughed from the plastron, and the reason they've sloughed is because there are foci here of infarction in the dermal bone, and when the plastron is removed, a large coelomic abscess is revealed. And that's the real reason why the scutes are sloughing rather than a primary cutaneous disease. These are cut surfaces of a ovarian follicle that reveal an abscess within the follicle. The follicular material seems to be an excellent medium for bacterial colonization, and abscesses readily form in these tissues and may serve as a nidus for chronic intermittent septicemia. It's particularly common to find bacterial abscesses in the ovarian follicles in episodes of follicular stasis or egg impactions or dystocias. Bacterial osteomyelitis is somewhat common in iguanas as well. Lytic changes occur in the joints of the long bones. Oftentimes salmonella or a coliform is isolated from this lesion. Transverse section through the brain of a sea turtle at approximately the level of the mid-cerebrum, showing an abscess that is contiguous with both cerebral hemispheres and extends into the midbrain, a PAS stain in the histologic section to accentuate the outline of the abscess. It is not difficult to see why a turtle with this lesion might become beached or might be struck by a propeller or have troubles swimming. Spectaclitis is occasionally seen in snakes, rarely seen in geckos and skinks. Snakes and some geckos and skinks have spectacles over the eyes, which are a modified layer of skin that sloughs off when the snake sheds its skin. In periods of dysectasis, when the skin does not shed properly due to environmental or traumatic episodes or bacterial infection, the spectacle can become retained. Or, for various other reasons, ascending infections of the tear ducts, an abscess can form beneath the spectacle, and that's called spectaclitis or a subspectacular abscess. This illustration shows one of these abscesses beneath the spectacle of a python. The abscess material can be aspirated from the spectacle, and in early cases, vision can be restored with proper medication. Edema disease is a term that is often used by clinicians and pathologists that do work with reptiles and amphibians. But edema disease is not a single entity. It merely implies that there is edema accumulating in various tissues, particularly the subcutis. And it's generally associated with vascular lesions, as would occur with sepsis or cardiomyopathy, cutaneous mineralization, renal disease, or combinations of these processes. This is a turtle with a presentation that could be termed edema disease. Note the marked outpooching of the skin to the extent that the turtle cannot even draw its head back into its shell. This turtle is septic, and it's leaking fluid because of degeneration in the vessel walls, probably due to endotoxemia. And the reason that I know that it's septic is because I can see pinpoint foci of red discoloration in the plastron, typical of the hematogenous spread of a septic process to the shell. Necrotizing stomatitis is very common in snakes, less commonly seen in lizards, chelonians, and crocodilians. Mixed bacterial and fungal infections are common. Many different kinds of organisms are isolated from these lesions, usually a combination of coliforms and Pseudomonas admixed with fungal agents, such as Fusarium. These conditions are almost always associated with poor husbandry, mouth trauma, or stress. This illustration represents an advanced stage of necrotizing stomatitis in a boid. Note the deformation of the jaw, the exudate in the mouth. There's even some flaking and accumulation of exudate in the skin. An earlier stage of this condition might be manifested by edema in the pharynx and in the mucosal soft tissues to the extent that the snake can no longer close its mouth properly. Looking at an open mouth down on the mandible to show some of the deformation that occurs as a result of necrotizing stomatitis. Many snakes have 4 dental arcades, an inner arcade and an outer arcade on each side. And in this particular case, there's marked deformation of the inner arcade with swelling of the mucous membranes and some ulceration and necrosis due to necrotizing stomatitis. The reason that these animals get stomatitis is generally due to trauma. Many years ago, it was common to perform venipuncture on these animals via the oral blood vessels. But in so doing, it requires that the mouth be pried open, often with tongue depressors, and then venipuncture obtained from oral vessels along the hard palate. This process causes fracture of the teeth and trauma to the oral mucous membranes, and hematomas occasionally form here in the mucosa and submucosa, resulting in bacterial colonization and necrotizing stomatitis. Another common cause is this form of trauma, in which this snake is being allowed to chew on the shoe of an employee at the veterinary clinic, when in fact this is causing a great deal of damage to this snake's mouth to do this. Periodontal disease is occasionally seen in agamids and chameleons, which have acrodont dentition. Acrodont dentition implies that the gingiva does not cover the junction of the tooth and bone so that the bone is exposed. These animals are predisposed to so-called periodontal disease. An inappropriate captive diet seems to be a major precipitating factor in the development of periodontal disease. This illustration depicts the acrodont dentition. This is the tooth. This is the alveolar bone. And this is the buccal mucosa. Note that the gingiva does not come up to cover the junction of the tooth and bone. Early stages of periodontal disease associated with this disorder. Here's the junction of the tooth and bone. Here's this sulcus in which debris becomes entrapped, leading to exfoliation, bacterial colonization, and inflammation in the underlying mucosa. Advanced stages in which food has been trapped in this sulcus, and there's an inflammatory response to the food material, some hyperplasia and ulceration of the mucosa. Here, an ascending bacterial infection is beginning to develop in the salivary glands. It starts in the duct, and then an abscess or granuloma forms in the salivary gland itself. A more advanced stage and yet a more advanced stage of the granuloma formation in the salivary glands of one of these lizards. Bacterial shell disease is common in captive and wild chelonians. Benechia chitinivora has been isolated from natural cases and experimentally shown to be a cause of bacterial shell disease. However, many natural cases have mixed bacterial populations, and the condition is likely multifactorial. In fact, shell trauma or burns may be major predisposing factors to bacterial shell disease. And of course, we've already talked about the cutaneous manifestations of septic processes that are particularly common for bacterial shell disease. It's important to know your species as well. For instance, this turtle has many yellow-white spots on its shell, but these are not lesions. This is a spotted turtle. This turtle has stripes or linear areas of yellow coloration in the shell because it is a striped mud turtle. Discrete pinpoint foci of ulceration or exudate or discoloration in the keratin layers are typical of hematogenous spread of a septic process to the shell, as opposed to being a primary shell infection. And this is by far the most common manifestation of bacterial shell disease that is seen. For instance, in this septic turtle, there is an area of keratin degeneration and discoloration on the plastron. The scutes are easily lifted from the shell bone in this condition to expose the underlying problem, which is actually a focus of red discoloration corresponding to an infarct due to sepsis in the dermal bone. And that particular turtle had a large abscess in the liver, which was the nidus of the infectious process and the source of the hematogenous spread. Fungal infections in reptiles are very common and usually involve the skin, oral cavity, and lung. Almost always, fungal infections are associated with environmental or substrate problems. Rarely do they seem to be the primary pathogen involved in a disease condition. Immunosuppression, stress, inappropriate substrates, concurrent disease processes, other infectious agents seem to be involved when fungal infections are present. A number of different fungal agents have been isolated with some regularity from inflammatory lesions in reptiles. and this is a partial list of those that are in the literature. With the possible exception of mucor, these agents are all most likely opportunists. The western pond turtle is an endangered species that is being propagated in captivity for release to the wild. These propagation programs have been very successful, but in captivity we occasionally will see some shell disease in the young turtles associated with mucor infection. This gallery of photomicrographs illustrates normal keratin of the scute and colonization of the keratin layers by mucor and associated disease. Primary infections of the skin and shell are uncommon, predominantly because of this thick organized keratin layer that is termed the scute, and it is an impervious layer. Mucor can colonize the keratin layer and cause keratin degeneration and subsequent ulceration, necrosis of bone, and pathologic changes. Generally, this takes place in the absence of other disease processes and in well-nourished turtles that do not appear to be stressed. And in this regard, this may be a primary fungal pathogen. Here is a higher magnification of the degenerative keratin, and here is a fungal stain of the degenerative keratin layers showing the fungal elements embedded in the keratin. Culture would be needed to further characterize these organisms as mucor. Secondary fungal infections associated with other problems are common. In this case, a congenital form of dysectasis, or inappropriate shedding of the skin, predisposes this snake to secondary fungal infection of the keratin layers. In this snake, the ventral distribution of dermatitis is due to a substrate that is too wet. Subsequently, fungal colonization of the degenerative keratin layers occurs, and sepsis can also occur. This albino alligator has multiple papillomas in the skin. Typical histologic appearance of the papillomas is that of papilliform proliferation of the epidermis and keratin production by the tumor. The keratin layers are readily colonized by fungal agents, as depicted in this fungal stain. Over time, the fungal agents can invade the dermis and lead to fungal septicemia. This is a common process in reptiles with long-term or recurrent papillomatosis. We're going to begin now viral infections in reptiles. There are a number of distinct viral entities in reptiles that I've listed on this slide, and we will discuss each in more depth. We'll begin with herpes virus infections in tortoises. A number of different species seem to be particularly predisposed to developing stomatitis, and these include the Argentine, desert, spur-thighed, and red-footed tortoises. The disease is seen less frequently in other tortoises. Typically, these animals present with necrotizing stomatitis and rhinitis. Histologically, the lesion is mucosal necrosis and inclusions are present in the necrotic or degenerating epidermis. Diagnosis is made by histopathology, electron microscopy, and PCR. The typical gross presentation for herpes virus stomatitis is the formation of plaque-like material on the mucous membranes of the mouth. A more florid manifestation is present in this image. Histologically, typical intranuclear inclusions of herpes virus infection associated with epidermal proliferation, necrosis, and submucosal inflammation. Herpes viruses also occur in marine turtles. A condition is known as gray patch in aquaculture green turtles, primarily young turtles, and manifests as patchy skin lesions. Another form of herpes virus infection occurs in older green turtles and is referred to as lung, eye, and tracheal disease, or LET, and it's predominantly a respiratory and conjunctival manifestation of herpes virus infection. Fibral papillomatosis is a devastating disease of herpes virus, caused by a herpes virus in sea turtles, predominantly green turtles, but also loggerhead turtles and in hawksbill turtles. This is the typical gross lesion of gray patch disease in a mariculture reared green sea turtle, and the typical histologic appearance with proliferation, balloon degeneration of the epidermis, hyperkeratosis and crusts, and a higher magnification showing the typical intranuclear eosinophilic or amphiphilic inclusions in the degenerating epithelium of the epidermis. Histologic changes associated with LET, proliferation, necrosis, even syncytial cell formation involving the respiratory mucous membranes, and typical intranuclear inclusions in the degenerating cells. Fibropapillomas in green turtles are a devastating disease of the wild turtle population, and they have been diagnosed from many areas of the world. A herpes virus is associated with this condition, and typically these turtles will have papillomas covering the skin, the eyes, and the fins, flippers rather. Internal papillomatosis also occurs, although it is primarily the fibromatous component of the fibropapilloma rather than the epithelial component. Formation of intranuclear inclusions typical of herpes virus is rare in this condition and should not be an important criteria for the diagnosis. Rather, the clinical presentation, species involved, and the morphologic appearance of the fibropapilloma are much more useful. This is the typical appearance of a sea turtle with advanced fibropapillomatosis. Numerous small and large papillomas are present on this turtle. Some of them are white or red, and some of them are quite dark. These will eventually resolve spontaneously. However, these turtles can't swim well or eat well, and some can't see, and subsequently they waste away in their aquatic environment. A condition of this nature is not conducive to survival in the wild. Typical histologic appearance of the fibropapilloma is epidermal hyperplasia and hyperkeratosis, supported by a moderately cellular fibrous stroma. A higher magnification showing the epidermal pegs that extend into the fibrous tissue. A histologic appearance of the fibromas occurring in the kidney. And occasionally, rarely, we see malignant manifestations of the fibrous component. Here is an embolus of fibrosarcoma in a blood vessel in the lung. Fibropapillomas also occur in species other than green sea turtles. They occur in the hawksbill turtle as well as the loggerhead turtle. The next viral disease I would like to discuss is adenovirus in bearded dragons. Adenovirus in bearded dragons causes hepatomegaly due to necrotizing hepatitis, and numerous intranuclear inclusions are seen in the hepatocytes and occasionally in the bile ductules. Inclusions are also occasionally seen in the enterocytes of affected animals, but generally without much, if any, pathologic change in the enteric mucosa. Diagnosis is by histopathology and electron microscopy. This is the liver of a bearded dragon with adenovirus infection. The liver is enlarged, mottled due to necrosis, and has some rounded margins. Histologic appearance of liver from a bearded dragon with adenovirus infection: numerous large basophilic or amphiphilic inclusions in the nucleus of the hepatocytes. There's also some fatty change in these hepatocytes. And occasionally we'll see some intranuclear inclusions in the enterocytes as well, but without much change in the enteric mucosa. Paramyxovirus is also seen in snakes and caiman lizards and green iguanas. In the snakes, it is particularly common in the vipers, occasionally seen in the colubrids and boids. These animals present with respiratory difficulty and what is perceived as central nervous system signs, or the animals may be found dead with no prior medical history. Gross lesions include reddened lungs due to proliferative pneumonia and occasionally changes in the pancreas. Histologically, proliferative pneumonia and ductular dysplasia are seen. Proliferative pneumonia and ductular dysplasia in the pancreas, salivary glands, or bile ducts. Some snakes will also have encephalitis, particularly pythons. Diagnosis is by histopathology, culture, serology, electron microscopy, and immunohistochemistry. Snakes with paramyxovirus have a variety of gross presentations, but a presentation such as this is not uncommon. The snakes are present with an inability to right themselves and apparent central nervous system signs or respiratory distress. Snakes that have advanced stages of respiratory disease will sometimes present with epistotonus or open mouth breathing or shaking their head, mimicking a primary central nervous system lesion. The gross appearance of the lungs in a snake: normal lung is tubular with a nice honeycomb appearance on the inner surface. Affected lung due to paramyxovirus infection, diffuse congestion, and occasionally a scant exudate within the central lumen, especially if there is secondary bacterial infection. Histologic appearance of paramyxovirus infection: typically a proliferative change in the pneumocytes of the lung. Note marked proliferative change along the alveolar surfaces, and exudate of edema and granulocytic cells within the alveolar lumen. This change is not pathognomonic for paramyxovirus infection and will be seen with any form of subacute to chronic inflammation in the lung. Occasionally, non-suppurative meningoencephalitis can also be seen in snakes with paramyxovirus infection, and with luck, occasionally cytoplasmic eosinophilic inclusions can be found, particularly in nervous tissue. An interesting and important change that is seen in paramyxovirus infection is the dysplastic changes that occur within the ducts of the pancreas, salivary glands, and portal tracts of the liver. These are normal salivary glands from a snake, showing the typical mucoid respiratory epithelial cells lining the surface. These are the dysplastic changes that occur in the salivary gland, and similar dysplastic changes occur within the pancreatic ducts and biliary tree. And these include ductular necrosis, squamous metaplasia, ductular distension, and some atypical change in the ductular epithelial cells that can be even misconstrued as neoplastic. Electron microscopy from an inclusion of a snake with paramyxovirus. This is the inclusion, and these are the filamentous particles typical of paramyxovirus infection. Immunohistochemistry can also be used for paramyxovirus infection, although the sensitivity of this procedure decreases markedly if the tissues have been in formalin more than 48 hours. Papillomatosis is seen in a broad variety of reptiles, including turtles, iguanas, bearded dragons, and alligators, caused by a papillomavirus or several strains of papillomavirus. This is a white alligator with numerous papillomas along the tail, and the typical presentation of these papillomas is fibropapillomatous change or proliferation of the epidermis and hyperkeratosis. Frequently these are colonized superficially by fungal elements. In the soft-shelled turtle and other aquatic chelonians, it is not uncommon to find papillomas that are inverted, much like the inverted papillomas of dogs. In this case, the papillomas invert into the dermis and are associated with keratinaceous cyst formation. And it's not uncommon for these keratinaceous cysts to have fungal colonization. Inclusion body disease is commonly seen in the boid snakes. It has been formally documented in boids and palm vipers. The etiology has been undetermined, but it is believed to be a viral infection. Retrovirus reverse transcriptase has been found in supernatants from snakes with boid inclusion body disease. The condition causes wasting, central nervous system signs, secondary infections, and metabolic derangements. It's manifested by eosinophilic globular cytoplasmic inclusions in most tissues of various cell types. Diagnosis is by histopathology and electron microscopy. Inclusion body disease presents as often as lethargy, emaciation, or central nervous system signs, such as an inability to right the head, or opisthotonus, or a coiled behavior. Histologically, eosinophilic inclusions are in the cytoplasm of affected cells. Nice eosinophilic inclusions in the endothelium, or in the epithelium of the renal tubules, in the cytoplasm of hepatocytes, more in the renal tubules. Now, the electron microscopic appearance of a typical inclusion is that of a donut, a radiodense area with a central radiolucent area, and budding particles from both the luminal surface of the donut and the external surface of the donut. It has not been determined if these particles are viral or some other substance. Inclusions occasionally are made up of radiodense aggregates of amorphous debris and lamellar bodies, suggesting that they may represent accumulations of degenerative cell organelles. The inclusions can also be diagnosed cytologically, but with a great deal of care and a conservative interpretation. This lymphocyte has a inclusion body disease inclusion, as does this epithelial cell. But these inclusions do not stain eosinophilic with typical Romanowski stains. Stained with hematoxylin and eosin, this cytologic preparation shows these inclusions. Note that this cell, this macrophage obtained from the oral cavity of a snake, also has a cytoplasmic inclusion, but this snake did not have inclusion body disease. Thus, cytoplasmic inclusions that are seen in cytologic preparations without the aid of histopathology should be interpreted conservatively. For the next disorder that I would like to discuss is an intranuclear inclusion disorder that occurs in Morelia, particularly carpet pythons. This condition manifests as central nervous system signs, and histologically there is ganglionaritis and encephalitis and glial cell intranuclear inclusions of filamentous material. Typically, these animals present with non-suppurative encephalitis and gliosis, and have discrete eosinophilic inclusions in the nuclei of the glial cells. These animals also have non-suppurative inflammation in the myenteric ganglia of the gut. By electron microscopy, the inclusions are associated with margination of the chromatin and accumulations of filamentous material. Higher magnification of this filamentous material. The nature of this material is as yet undetermined, but the uniform size and periodicity of the material suggests that it is most likely viral. Pox viruses are occasionally seen in reptiles, particularly in lizards and crocodilians. Pox virus infections are self-limiting, but can be troublesome if there is concurrent secondary bacterial or fungal infection. Parasitic diseases are important disease processes in reptiles, particularly the protozoan infections, although nematodes, trematodes, cestodes, penistomes, acanthocephalans, and ectoparasites are also important. Of the important protozoan diseases, amoebiasis and coccidiosis seem most prevalent. There are 3 forms of coccidiosis that are clinically significant, and these include enteric coccidia, cryptosporidiosis, and intranuclear coccidiosis of tortoises. Amoebiasis in reptiles is usually caused by N. amoeba invadans. Blastocystis species is also commonly detected in the feces of reptiles, but is of uncertain pathologic significance. Amoebiasis manifests as enterocolitis and hepatitis and is commonly seen in chelonians, snakes, lizards, and crocodilia. It is undetermined if amoeba or entamoeba invadans in particular is a primary pathogen or if pathology is mediated by stress-related events or other pathologic processes. It is occasionally possible to find Amoeba invadans in the feces of clinically normal reptiles. The typical gross presentation of amoebiasis in a snake showing severe pseudomembranous necrotizing enterocolitis that usually extends through the wall into the serosal surfaces. Occasionally, a cylindrical, irregular cast of material can be passed from the cloaca in an animal infected with Amoeba invadans. And this cast is comprised predominantly of inflammatory cells and fibrin admixed with cell debris. Numerous pleomorphic bacteria may be present, and if you're lucky, the cast will also have some amoeba. Typically, these casts are found within the exhibit and are of unknown location. Necrotizing hepatitis is also a common manifestation of amoebiasis in reptiles, presumably due to hematogenous spread from the intestine. Severe hepatic necrosis can occur, sparing only some portions of the hepatic lobes. Cytologic examination of fecal material may show many forms of amoeba. Small amoeba with small single nuclei, smaller than the size of a reptile erythrocyte, are frequently seen in the feces of reptiles and usually are blastocystis species, and these are of undetermined pathologic significance. Entamoeba invadans is a larger organism perhaps 25 to 30 microns in diameter, and often with multiple nuclei or food vacuoles in the cytoplasm. Phagocytosis of cellular debris or host cells is also occasionally seen. Histologically, amoebiasis in the intestine is manifested by severe mucosal necrosis and ulceration and marked submucosal edema. Commonly, organisms are seen in other tissues. Here, an aggregate of amoeba is noted in the subcapsular space of the spleen. Here, amoeba are noted in the red pulp of the spleen. In this image, amoeba are noted in the capillaries of the lung. In this image, large numbers of amoeba are present within the focus of necrosis and inflammation in the liver. Cryptosporidiosis is an important protozoan pathogen of a number of different reptiles, including colubrid snakes, geckos, iguanas, and bearded dragons. In colubrids, the condition is primarily manifested as gastritis. The mucosa becomes proliferative. A bulge can be detected in the anterior third of the body, and the snakes often present with regurgitation. In geckos, the condition is mostly confined to the intestine and is associated with wasting. In iguanas, the condition is associated with the eustachian tubes and the ear canals and causes swelling and outpouching of the tympanic membrane. The typical appearance of the mucosa of a gecko with enteric cryptosporidiosis is that of proliferation and an increase in the tortuosity and branching of the villi. Organisms often are numerous along the apical surfaces of the enterocytes. Cytologically, cryptosporidia can be detected in gastric lavages or from imprints of the gut. However, the interpretation should be made conservatively in the Wright-Giemsa stain smears, in which the organisms are spherical but could be easily mistaken for mucus or cellular debris. It is important to do an acid-fast stain in the cytologic preparations to be certain that these are cryptosporidia, which is an acid-fast organism. Gross presentation of cryptosporidiosis in the stomach of a corn snake. A swelling, a distinct swelling in the anterior third of the body, corresponding to marked gastric enlargement. The stomach is enlarged due to proliferation of the mucosa. A higher magnification showing marked proliferation of the gastric mucosa due to cryptosporidiosis. Gross presentation in an iguana with cryptosporidiosis involving the middle and inner ear. Typically, the condition is associated with marked edema and inflammation in the ear canal and subsequent outpouching of the tympanic membrane, which normally sits flush with the surrounding skin. Iguanas and other reptiles generally do not have external ear canals. Cryptosporidiosis, until a few years ago, was not thought to occur in tortoises or turtles. But in fact, cryptosporidiosis is seen in tortoises, predominantly in the stomach, but occasionally also in the intestine. In the stomach, it is associated with mild forms of gastritis, glandular atrophy, and fibrosis in the lamina propria. Generally, it is associated with low numbers of organisms on the mucosal surfaces of the stomach, and the significance of the organism's presence relative to the histologic changes is undetermined. Typical histologic appearance of a tortoise with gastric cryptosporidiosis. Note the mild fibrosis in the apical regions of the lamina propria, a mild cellular infiltrate, and rare organisms on the apical surfaces of the mucosal epithelium. Another form of cryptosporidiosis occurs in the conjunctiva of bearded dragons. These animals will have bilateral proliferative changes in the mucosa of the conjunctiva, resulting in blepharitis, swelling of the conjunctiva, and an exudate in the conjunctival folds. The histologic appearance is typical of cryptosporidiosis. Hyperplasia of the mucosal epithelial cells and large numbers of organisms lining the apical surfaces. In the cytologic presentation, numerous organisms in various stages of development can be seen, including schizonts oriented around residual bodies, such as this structure here, or gametes, such as this structure here. Enteric Coccydiosis caused by Isospora or Isospora-like species is occasionally seen, but mostly in bearded dragons, where it is associated with enteritis, diarrhea, and wasting. It is generally considered a husbandry problem because these lizards tend to reinfect themselves from dirty substrates. Intranuclear coccidiosis is a problem only in certain species of tortoises, primarily tortoises from the Mediterranean region. Radiated tortoises were the first tortoises in which this disease was diagnosed. Typically, the condition is associated with wasting, although recently it has been associated with rhinitis. The disease typically causes severe systemic non-suppurative inflammation in all the viscera, and all stages of parasite development appear to occur in the nucleus of epithelial cells. Occasionally, merozoites can be found in the cytoplasm of macrophages, but probably due to phagocytosis following rupture of an infected cell rather than a developing stage occurring in the cytoplasm of the macrophage. The oocysts have yet to be isolated or cultured, so the life cycle of this parasite is undetermined. By electron microscopy, we know that it is an apicomplexan coccidian parasite. The gross appearance of the nasal choanae in a normal tortoise is such. There are 2 choanal slits, one for each nasal cavity. In those tortoises infected with intranuclear coccidiosis, there is often marked deformation of the nasal choanae due to necrosis and remodeling of the turbinate bone. The cytologic appearance of the mucosal epithelial cells infected with intranuclear coccidia is typical. In this nucleus is a developing schizont, and in these nuclei are gametes of this parasite. The intranuclear coccidia that occur in tortoises are acid-fast, so it is important to use an acid-fast stain when screening cytologic preparations to accentuate the presence of the organisms and to aid in the diagnosis, particularly when the organisms are in low numbers in the cytologic preparation. The organisms are also PAS positive. However, there is much background staining with the PAS stain because of the presence of mucus and cellular debris, and the acid-fast stain is a better differential staining procedure. Histologically, intranuclear coccidiosis is characterized by systemic inflammation and necrosis. The kidney is an important target tissue, and in this photomicrograph there are numerous foci of inflammation associated with renal tubular necrosis. a higher magnification of the affected tubules showing numerous intranuclear coccidia in the renal tubular epithelial cells. Higher magnification showing the coccidia within the tubular epithelial cells. Note a developing schizont in this cell. Another target tissue is the pancreas, and this is a low power magnification of the pancreas of a tortoise with intranuclear coccidiosis. Note the complete loss of pancreatic architecture. This is due to extensive fibrosis and necrosis occurring within the pancreatic parenchyma, also accompanied by significant inflammation. Note only a few residual acinar structures interspersed with broad zones of fibrosis. A section of the intestine showing numerous developing stages of the coccidia within the enterocytes. Higher magnification showing the organism present within the nuclei, and here early stages of exfoliation into the lumen. Occasionally, the organism also occurs in the mucosal epithelium of the inner ears, as in this case, where numerous oocytes are being shed into the lumen of the middle ear, likely to be expelled through the eustachian tube. Higher magnification of the mucosa of the inner ear showing these organisms developing in the epithelial cells and being sloughed into the lumen. Higher magnification of individual cells showing developing schizonts in the nucleus. This is an oocyst, free in the lumen. Occasionally, the organism can be found in the cytoplasm of the macrophages, usually a merozoite, but this is most likely due to phagocytosis following rupture of a degenerative cell, rather than a developing stage occurring within the cytoplasm of the macrophage. By electron microscopy, gametes or schizonts can be found in the nucleus, typical of apicomplexan protozoa. Tremetodiosis is seen frequently in reptiles. Monogeneans are common in turtles in the urinary bladder, nose, and mouth, and are generally considered incidental. Digeneans are common in the upper alimentary and respiratory tract of snakes and are associated occasionally with opportunistic bacterial infections. Staphylodoros, a digenean renal fluke in snakes, can be associated with significant renal tubular damage. Spirochid tremetodiosis is perhaps the most common manifestation of tremetodiosis in reptiles, particularly in turtles. It is a vascular trematode, and the adults live in blood vessels, lay ova that migrate through the viscera and are associated with formation of microgranulomas oriented around the migrating ova. The condition is most often incidental, although severe encephalitis can result under certain circumstances, particularly in loggerhead turtles. This is the brain from a loggerhead turtle showing areas of granulomatous inflammation, these foci of white nodular discoloration and proliferation. There's also some green discoloration due to meningitis associated with large numbers of trematode ova migrating miracidium. This is the meninges from the same turtle showing mature trematodes in the blood vessels. This is a microgranuloma oriented around a trematode ovum in the brain. Meninges showing marked thickening of the meninges due to a cellular infiltrate containing numerous trematode ova, and also some miracidia that are hatching from the ova and migrating through the tissues. In the loggerheads, Advanced cases of cephalic tremetodiosis have also been associated with axonal degeneration and edema in the peripheral nerves, marked atrophy of fat, fibrinoid degeneration of vessel walls, and secondary or concurrent herpes virus infections, suggesting that there is a factor of immunosuppression and emaciation associated with this process as well. Nematodiasis is also seen in reptiles, but generally is not a significant clinical problem. Adults are in the alimentary tract, larvae are in the viscera. Rhabdius species lungworms are seen in the adults are seen in the lung, and the larvae are seen in tissues or migrating transcutaneously. Strongyloides is occasionally seen in the gut and associated with diarrhea. And oxyurids, or pinworms, are frequently seen in the cecum of iguanas. Initially thought to be an incidental finding, they are occasionally associated with impactions and cloacal prolapse. Philarid worms are also common in reptiles, particularly in chameleons. Adults are common in the great vessels or renal veins, subcutis or on the coelomic surfaces, and microfilaria are readily seen in the blood. Rarely the adults can be pathogenic in heavy burdens, but the microfilaria are incidental. Gastric larval granulomas are occasionally seen in lizards and rarely in snakes. These are caused by a number of different nematodes, and histologically the species of nematode cannot be ascertained in the larval sections. This is the typical appearance of the larval granulomas seen in the stomach of reptiles. A granuloma oriented around a convoluted larva in the mucosa or submucosa of the stomach wall. This is a coiled philarid, adult philarid on the mesenteric surfaces of the coelomic cavity. This is a adult philarid being removed from the subcutis of a chameleon. Cecal impaction in an iguana due to large numbers of oxyurid nematodes admixed with fecal material. A plastic baggie containing large numbers of oxyurids harvested from an impacted cecum of an iguana, and a large mat of these oxyurids admixed with fecal material in the cap of a fecal flotation device. It is common to see, or occasionally, you can find prolapse of the cloaca or the colon associated with cecal impactions due to oxyurids in iguanas. I'm cheating here a little because this is a gecko. I did not have a slide of a prolapsed cloaca from an iguana, but it is a somewhat common sequel to pinworm infection. Penostomiasis implies infection with primitive arthropods, and it is common in iguanas. Mostly the adults are found in reptiles, usually in the lung, upper respiratory tract, or coelomic cavity. Tissue damage at the site of attachment or in the migratory stages occasionally occurs, and acute fatal airway obstruction can also occur with some species of penostomes. Here, some penostomes are being removed from the glottis of a venomous snake. These are penostomes attached to the serosal surfaces of the viscera of an indigo snake. A penostome attached to the serosal surface of the stomach in a gecko, and numerous linguatid penostomes in the lumen of the trachea and glottis of a bushmaster that actually caused acute respiratory distress and death in this snake. And a comparison of the size of one of these linguatid pentostomes relative to the size of a Bushmaster's fang. Cesta Diocese is frequently seen in reptiles. The definitive stages occur in the gut, predominantly of the Protocephalidae. The intermediate stages occur in the coelomic viscera, predominantly the Mesocestoididae, or in the subcutis, predominantly the Pseudophilidae. And perhaps the most common are the Pseudophilidae in the subcutis, the so-called sparganum or sparganosis, seen in reptiles, particularly snakes and lizards. Usually, Cesta Diocese is an incidental finding, although occasionally the cysts in the subcutis can rupture, resulting in relatively severe cellulitis with sinus tracts and secondary bacterial or fungal infection. This is an iguana with coelomic cestode cysts that have been opened to reflect the developing parasite. This is an indigo snake with a sparganum that is being removed from the subcutis by rolling it on a cotton swab. Histologic presentation of numerous cestodes in the lumen of the intestine of a bearded dragon, and this is an incidental finding in this animal. Acanthocephalans, or thorny-headed worms, are occasionally seen in snakes and turtles, and the adults occur in the gut and are associated with minor irritation. Occasionally, granulomas are seen in the viscera associated with larval migration. Generally, though, acanthocephalans do not cause significant disease processes in reptiles. Perhaps where they are most commonly seen is on the mucosal surfaces of the distal small intestine and colon in the aquatic chelonians. Ectoparasites are common in reptiles, and a broad spectrum of ectoparasites occur. Mites are common in snakes and lizards. Ticks are common in snakes, lizards, and chelonians. Fleas are occasionally seen in tortoises, and barnacles are quite common in aquatic turtles. Leeches are occasionally seen on the skin of turtles. This is a boid with a tick attached to the skin of the head. This is an anole with a tick in the nasal cavity. Note the opposing nasal cavity that does not have a tick for comparison. And this is the tick removed from the nasal cavity. This is the skin of the neck from an imported tortoise in Florida. Note the large numbers of ticks embedded on the neck. These are amblyoma ticks and the vector for heartwater disease. The presence of these ticks on imported tortoises in Florida has caused concern for the possible importation or inadvertent importation of heartworm from infected countries. This mite is Ophianus natresis, the snake mite. The snake mite is very common and can be associated with significant dermal irritation in snakes. Also, it is seen in lizards. Typically, it is associated with flaky red dander, primarily on the face and around the eyes, and sometimes associated with some periocular swelling. A similar condition occurs in lizards and associated with discoloration and flaking of the skin. Advanced cases have ulceration or scarring, and there is sometimes a red tinge to the flaky material in the lizards, as seen in the snake. Mites can be difficult to see grossly because they tend to hide under the scale folds. This is a more or less normal scale fold in which keratin has accumulated in the fold of the overlapping scale. The next scale over has a mite underneath the scale fold. These can be difficult to see clinically. Hemoparasites are occasionally seen in reptiles. Plasmodium, Hemoproteus, and Hemogregorins are the most common. Trypanosomes are occasionally seen, and Microfilaria are occasionally seen. However, these parasites are usually incidental. The tissue phases of the Hemogregorins can cause mild irritation, or rather mild inflammation, when the burden is large. And if the parasites are in large numbers in the lung, they can be associated with some respiratory distress. These are Hemogregorins occurring within the cytoplasm of infected erythrocytes. The organisms are typically cylindrical and have a central nucleus. They are associated with mild displacement of the nucleus of the erythrocyte, but otherwise cause little trouble. When the infections are heavy, the schizont stages in the endothelium of the lung can be associated with some mild inflammation and some difficulties in breathing. This parasite is an extracellular parasite in the blood of a gecko. This is a trypanosome. Note the marked, or rather the undulating membrane, characteristic of the trypanosomes. These organisms are considered an incidental finding and are somewhat common in geckos. One pseudoparasite that all pathologists should be aware of is the basophilic bodies that are occasionally seen in the cytoplasm of reptiles, but which are not parasites at all. These bodies represent budding fragments of the nucleus, enveloped accumulations of cellular debris, and possibly some degenerative cellular organelles. But they most often do not represent parasites. This concludes our discussion on infectious diseases of reptiles. Ian. We'll now begin with non-infectious disease processes of reptiles. Cardiovascular disease is occasionally seen in reptiles. Cardiomyopathies occur in snakes and monitors. The cause has not been determined. Occasionally, they will have thrombosis of the caudal vena cava, particularly in boids. Vascular mineralization is another manifestation of cardiovascular disease that we see in reptiles. The reptile heart, particularly that of the chelonians and lizards, has some degree of dorsal ventral flattening compared to that of mammals, and the atria are generally prominent. The gross appearance of the heart with cardiomyopathy is difficult to discern from the normal appearance of the reptile heart. In transverse sections, it is difficult to determine that there is a disease process present, so it is important to do histopathology. In those cases of cardiomyopathy, it is common to find chronic passive congestion involving the lungs with subsequent swelling and red discoloration of the pulmonary parenchyma, and occasionally large thrombi may form in the caudal vena cava. The histologic appearance of the cardiomyopathies in reptiles is generally that of fibrosis with disruption of the normal organization of the myofibers. Note these areas in this low magnification photomicrograph. Note these areas of pallor here in the trichrome stain that correspond to fibrosis in the myofibers, or in the myocardium. Higher magnifications showing the green staining of the fibrous tissue within the heart and the disorganization of the red staining myofibers. Also note in the higher magnification these areas of fibrosis and edema in the interstitium. Cardiomyopathies or cardiac insufficiency are typically associated with ascites, as they are in other mammals and birds and so forth, and accumulation of amber fluid in the coelomic cavity. Cytologically, the fluid will have low cellularity, predominantly erythrocytes and occasional mononuclear cells or granulocytes that are non-degenerative. It's important to do cytocentrifuge preparations of the acidic fluid to condense the cells and minimize the possibility of missing an important infectious agent or neoplastic process. Occasionally, myocarditis is seen as a manifestation of sepsis, but it's not a primary cardiac disease. White foci in the myocardium are typically seen in septic animals. In snakes, the heart has a somewhat more heart-like appearance, if you will, than in the tortoises and lizards, but also has prominent atria that tend to wrap themselves around the ventricle. In snakes, occasionally, prominent endocardiosis can be seen in the heart valves of aged animals. Degenerative diseases are only rarely seen in reptiles. Occasionally arthritis, cirrhosis are seen. Chronic renal disease is perhaps an exception, as this is a common disease in lizards, particularly iguanas. Cirrhosis is most commonly seen in lizards, particularly iguanas, and the cause is undetermined, primarily because by the time that the lesion is examined by a pathologist, the chronicity of the lesion makes interpretation of its underlying cause difficult. The condition may be precipitated by lipidosis, biliary obstruction, hepatotoxins, aging, and exuberant melanosis. Degenerative arthritis is seen occasionally, usually in the large reptiles such as crocodilians and the giant tortoises. It predominantly involves the long bones and occasionally the vertebral articulations, especially the condyle joints. Here's a condyle joint from the vertebra of an alligator showing some degenerative changes in the cartilage and also some proliferative bone changes and subsequent spondylosis. Low magnification of degenerative arthritis occurring in a lizard in which osseous metaplasia and proliferation into the spinal column has caused compression of the spinal cord. Now, chronic renal disease is common in all reptiles, but we most commonly see it in iguanas. Aging and previous renal insults likely predispose to this condition, and it's characterized by marked renal enlargement with concurrent gout, mineralization, and interstitial fibrosis, and is frequently associated with concurrent metastatic mineralization due to derangements in calcium and phosphorus metabolism associated with renal insufficiency. This is the normal pelvis of an iguana. The colon runs through the center of the frame, and on either side of the colon are two normal two normal kidneys. This is an iguana with advanced chronic renal disease in which the kidneys, particularly anterior poles of the kidneys, are markedly enlarged and associated with obstruction and impingement on the distal colon. These animals often present with constipation. Histologic appearance of chronic renal disease in an iguana: marked fibrosis and edema in the interstitium, disruption of the normal architecture of the tubules, tubular distension, and occasionally discrete urate tophi within the tubules. Deposition disorders are common in reptiles and can be significant causes of morbidity and mortality. Some of the deposition disorders include mineral, melanin, lipid, urates, cholesterol, and uroliths. Amyloid or amyloid-like deposits are seen occasionally in Komodo dragons, but are otherwise rare in reptiles. This amyloid-like material can cause white discoloration of the parenchyma of the tissues, as seen in this spleen or in this kidney, and have the typical appearance of amyloid, with amphiphilic material deposited within the walls of blood vessels or in the interstitium of the kidney. Mineralization is common in reptiles, particularly in herbivorous lizards. Mineralization can be associated with dietary imbalances, renal disease such as gout, or follicular stasis. It predominantly involves the great vessels, the kidney, the lung, the gut, and the skin. Mineralization can be detected radiographically in its advanced stages, as seen in the aorta of this iguana. The aorta removed, showing the deposition of mineral in the wall of the aorta. Deposition of mineral in the parenchyma of the kidney. And extensive mineralization of the lung, in this case associated with hemorrhage into the lumen of the lung due to fracture of mineralized vessels. Mineralization within the tubules of the kidney, along the basement membrane of the skin, of the epidermis in the skin, and within the muscular tunics of the heart. Iguanas have a unique regenerative erythroid response in the absence of anemia associated with mineralization of the lung. This is likely due to ventilation-perfusion mismatch, signaling the bone marrow and extramedullary hematopoietic tissues to produce erythroid precursors. The detection of a regenerative erythroid response in the peripheral blood of an iguana without anemia should warrant a poor prognosis, as it implies extensive mineralization of the pulmonary parenchyma. Note the numerous erythroblasts and mitotic figures in the erythroid component in this blood film from an affected iguana. Also in this film, note the erythroid precursors. The condition is associated with erythroid hyperplasia in the sinuses and in the red pulp of the spleen. Iguanas with mineralization of the lung frequently present with sudden death due to rupture of a blood vessel and hemorrhage into the alveolar lumina of the lung. Note the extensive mineralization occurring within the capillaries at the exchange barrier in the lung. Also note a von Casa stain accentuating the presence of extensive mineral deposits in the capillaries of the alveoli, or in the alveolar septae. Tumoral calcinosis, or pseudogout, or calcinosis circumscripta, is also commonly seen in reptiles, particularly uromastyx, chameleons, and chelonians. It typically involves the spine and the appendages and is associated with hydroxyapatite deposition. The etiopathogenesis of this disorder is not known. It differs significantly from gout in that it is radiodense and does not occur on articular surfaces or in the lumen of joints. It also does not occur in visceral tissues. It differs from metastatic mineralization in that it does not involve the viscera or blood vessels. Pseudogout is intensely radiodense. This is normal spine from a uromastyx, and this is a distribution of pseudogout in the vertebrae and in the long bones or in the soft tissues adjacent to the long bones. The gross appearance can be spectacular, with marked swelling of the toes or white nodular proliferations in the soft tissues beneath the skin. If the skin is peeled away, these white nodules are readily revealed. This is firm, granular material that is difficult to cut. A lateral view showing this marked nodular appearance of tumoral calcinosis in the uromastics. When the skin is peeled away, these coalescing nodules of yellow-white material are found. The gross and radiographic appearance of pseudogout occurring within the soft tissues of the feet in a turtle. Again, the skin is peeled away to reveal the nodules of white granular material. Also in the stifle joints of a chameleon. Cytologic appearance is that of a sort of amorphous, clear crystalline material admixed with blood. The histologic appearance is deposition of basophilic granular material consistent with mineral within the soft tissues, particularly within the connective tissue and tendons, and generally not associated with a significant inflammatory response. Tumoral calcinosis or pseudogout should not be confused with the accumulation of calcium deposits within the endolymphatic sacs or chalk glands of some lizards. This is a normal event. Melanin is commonly deposited in the viscera of reptiles, amphibians, and fish. Melanin deposition increases with age, wasting, free radical detoxification, and antigen processing. Melanin results in black discoloration of the viscera, the mesentery, and the skin. Hepatic dysfunction can occur if melanin deposition in the liver is severe. Melanin accounts for the spectacular range of colors that is seen in the skin of many species of reptiles, and amelanistic breeds or strains of reptiles are bred for the pet trade. This liver has a bacterial abscess in one lobe, but also accentuates the presence of large amounts of black deposits within the parenchyma that correspond to melanin within the melanomacrophage centers. The tan contrast in the hepatic parenchyma adjacent to the foci of melanosis represents hepatic lipidosis. This liver shows melanin deposition in one lobe and no melanin deposition in this large portion of the contralateral lobe where there is a hepatoma. In a formalin-fixed specimen with marked hepatic lipidosis, the contrast with areas of melanosis can be seen clearly. Histologically, melanin accumulates in hepatocytes and melanomacrophage centers. When melanomacrophage centers are in such size and number as to obscure the architecture of the hepatic parenchyma, the condition may be associated with clinical hepatic insufficiency and morbidity. Melanin deposits also occur in the mesentery, as shown in this lizard. And the reason that the melanin occurs there is because of the chromatophores that line the serosal surfaces of the mesentery. Note also the smooth muscle bundles that are occasionally detected in the mesentery of lizards. Gout is common in reptiles and uncommon in amphibians. Renal, visceral, and articular manifestations of gout occur in reptiles. It is mostly associated with dehydration and concurrent disease processes. High protein diets have been implicated, but this has been difficult to prove. Usually, concurrent disease processes or prior renal insults are present. A tokay gecko with numerous foci of urate deposition in the subcutis, readily visible through the skin. And when the skin is reflected, the body cavity is open, the urates are clearly visible. Urate deposits in the mucosa of the oral cavity of a snake, and urate deposits throughout the kidney, in this case associated with tubular distension and cyst formation, which is somewhat common in the renal manifestations of gout. Urate deposits are also seen on the surface of the heart, both on the epicardial surface and on the endocardial surface of the heart. The condition can be associated with discrete urate tophi within the interstitium and within the tubules of the kidney, fibrillar material along some of the serosal surfaces, and occasionally urate tophi along some of the serosal surfaces. Here, urate tophi are deposited within the liver, early urate tophus in the sinusoids of the liver. I'm sorry, this is a urate tophus in the spleen. Here, a urate tophus is in the interstitium of the lung, and here, urate deposits in the spinal canal associated with compression and destruction of the spinal cord. Cytologic appearance of urates is variable. They can be amorphous or polygonal, but oftentimes are peanut-shaped or rod-shaped and are birefringent with polarized light. More urate deposits in the kidney, not to be confused with active sexual segments in the tubules of male reptiles during periods of active sexual activity. These structures represent modified renal tubules that have hypertrophied epithelial cells and eosinophilic granules within the cytoplasm of. Hepatic lipidosis can be a major disease process in reptiles. It is generally associated with metabolic, endocrine, or nutritional disorders. The interpretation of hepatic lipidosis should be made conservatively. Fatty change occurs in the liver of reptiles during active reproductive status when females are mobilizing fat for folliculogenesis, and fatty change occurs in the liver in preparation for or emerging from brumation or hibernation. This bearded dragon is obese with large fat bodies and associated severe hepatic lipidosis. Note the marked yellow discoloration of the liver and the rounded margins and greasy appearance typical of hepatic lipidosis. Histologic appearance of the liver with hepatic lipidosis is that of markedly vacuolated hepatocytes, generally that have discrete cytoplasmic vacuoles and displacement of the nucleus. Xanthomatosis is seen in reptiles and amphibians. It occurs in the viscera, the cornea, and the brain, and may be associated with hypercholesterolemia. The hypercholesterolemia can be spectacular, with over 1,200 milligrams per deciliter of cholesterol. Females with active folliculogenesis may be overrepresented for the development of xanthomatosis, possibly due to mobilization of cholesterol during folliculogenesis. These animals may be found dead or may be lethargic with a history of wasting or may present with head tilt. Large xanthomas can be seen grossly, as in the brain of this lizard with xanthomatosis. Note the accumulation of white granular material within the neural pile. This is a transverse section through the skull of a snake with xanthomatosis in the brain. Note the accumulation of xanthomatous inflammation within the meninges and extending down into the neuropile with associated compression of the adjacent neuropile. Early stage of xanthomatosis occurring in the lateral ventricle of the brain in a gecko. Note the accumulation of cholesterol clefts and macrophages associated with mild distension of the ventricular lumen, similar to the cholesteatomas seen incidentally in horses. A gross appearance of advanced xanthomatosis in a gecko due to is typically a fusion of the viscera due to depositions of cholesterol clefts and granulomatous inflammation on the serosal surfaces of the viscera. Here, the serosal surface of the lung has a large xanthogranuloma, and here, accumulations of xanthogranulomatous inflammation within the interstitium of the pulmonary septae. A higher magnification view showing the stacks of cholesterol clefts delineated by macrophages and multinucleated cells. Urolithiasis is somewhat common in turtles and tortoises and iguanas. The cause is not known, and it is probably related to diet. The uroliths can achieve large size and be associated with displacement of the viscera. Subsequently, they can be obstructive in the urinary bladder and can cause compression and obstruction of the lower alimentary tract. Secondary bacterial infections occasionally occur within the lumen of the urinary bladder as a result of urolith formation. These uroliths are readily detectable by radiographs as radiodense spherical concretions. At surgery, these uroliths are easily visualized through the thin wall of the urinary bladder in this tortoise. A urolith successfully removed from the urinary bladder of a tortoise, comparing the size of the tortoise to the size of the urolith. This was a very large urolith. This tortoise was less fortunate and did not survive the urolithiasis. At necropsy, the urolith was retrieved from the bladder, placed back into the coelomic cavity to accentuate its placement and subsequent compression and obstruction of the alimentary tract. Scent gland and hemipene impactions are common in lizards, primarily iguanas, and these represent casts of inspissated exudate comprised of keratin and secretory material. Occasionally, secondary bacterial and fungal infection are seen in these impacted glands and hemipenes. If the glands or the hemipene should rupture, severe cellulitis with sinus tract formation and secondary bacterial and fungal infections result and can be clinically challenging to manage. These are the femoral pores on the medial aspect of the hind leg in an iguana, and these pores are impacted with secretory material. These are the accentuated hemipenes running along the lateral aspects of the vertebral column, caudal to the cloaca in a lizard. They are accentuated because they are impacted. Impaction is easily treated by grasping the material with a forceps and removing it manually. These are manually removed impacted secretory products of the scent glands. Anomalies are common in reptiles, primarily due to stressors during incubation, particularly extreme temperatures, either temperatures too high or temperatures too low in the incubator. A broad variety of anomalous developmental abnormalities are seen, such as two heads, one eye, no eyes, schisis of the midline, or absence of toes or legs. Inbreeding can produce anomalies as well. Prognathism in a tortoise, two-headed snake, nutritional diseases are very common in reptiles, particularly obesity in the large reptiles and emaciation in the herbivorous reptiles. Nutritional/metabolic bone disease is also common. Some less common problems are hypervitaminosis D, hypovitaminosis, and hypervitaminosis A, hypovitaminosis E, and derangements in iodine metabolism. Obesity is common in large sedentary carnivores: crocodilians, tegus, monitors, boids, and snapping turtles. And it can be associated with hepatic lipidosis. This is an obese python that also has a mass in the caudal third of the body. These are the fat bodies of an obese python. Coelomic distension associated with obesity in a bearded dragon due to marked enlargement of the fat bodies. This bearded dragon also has hepatic lipidosis. Emaciation can be associated with suboptimal nutrition, environmental maladaptation, conspecific aggression, poor exhibit design, and of course underlying disease processes. This basilisk is in the final throes of emaciation. Note the loss of muscling and the flabby skin and accentuated skeletal system. This turtle is also emaciated. Note the withdrawn appearance of the legs and head, the folds of skin, and the indentations in the legs from loss of muscle density. This indigo snake is emaciated due to bacterial infection in the coelomic cavity and subsequent hematogenous spread to the skin with ulceration. Now, the fat bodies in an emaciated animal are interesting in that they tend to be very reduced in size compared to the obese fat bodies in this python, but also are red, presumably due to the close clustering of capillaries and shrinkage of the adipocytes. The histologic appearance of the atrophic fat bodies is that of rich capillary beds interspersed with cells that no longer contain lipid. The parenchyma may also become atrophic, with atrophy of the hepatic cords, loss of zymogen granularity, and atrophy of the acinar cells in the pancreas. Atrophy of fat also occurs in the cardiac groove and in the marrow cavity of the bones. The marrow cavity is the last fat depot to atrophy in cases of advanced emaciation. Metabolic and nutritional bone disease are common in herbivorous reptiles, and in lizards it's associated with fibrous osteodystrophy. Fractures of the vertebrae can impinge on the cord and cause posterior paresis and paralysis. The affected animals have thin bone cortices and fractures with fibrous calluses and soft tissue swelling. Often, the animals have a swollen, flexible jaw. This is the typical gross presentation of an iguana with fibrous osteodystrophy due to nutritional bone disease. Note the swelling of the limbs due to fibrous tissue replacement of the bones. Also note the deformity and swelling of the jaw, particularly the lower jaw. radiographic appearance of an affected animal showing a marked loss in bone density. In fact, bones can hardly even be seen. And a marked increase in soft tissue density due to fibrous metaplasia in the areas of bone loss. Note the pathologic fractures in the ribs of this animal with marked bone loss, so-called rachetic rosary extending along the ribs, probably due to just routine handling of the animal. This chameleon has the typical callus formation along the ribs where the ribs are fractured, also has the soft tissue changes in the limbs, and in this case it is associated with underlying renal disease. Note the pathologic fracture in the vertebral body with associated impingement and compression of the spinal cord. Metabolic and nutritional bone disease in chelonians has a different presentation than that of lizards. It is primarily that of osteopenia, especially involving the shell. Chelonians don't seem to form the prominent compensatory fibrous tissue response seen in other reptiles, birds, and mammals. Some of these images are those of tortoises that have survived metabolic bone disease but have deformities in the shell relative to the size of the body. Note that this shell does not properly fit the body of this tortoise. Occasionally we see some irregularities or pyramiding in the scute keratin in animals that have survived metabolic bone disease. In this particular case of active metabolic bone disease, there's a marked loss of bone density and subsequent inward bowing of the carapace. In this case, this animal has survived metabolic bone disease but now has permanent scoliosis of the vertebral canal. This animal also has a granuloma adhered to the serosal surface of the shell. This case depicts perhaps the most severe manifestation of osteopenia due to nutritional bone disease in a tortoise. We are looking at the ventral aspect of the carapace, showing marked loss of bone density. In fact, you can even see to the ventral surface of the scutes. If the ribs or the scutes are visible from the ventral aspect of the carapace, then there is marked loss in bone density. Generally, in a well-nourished tortoise, the shell density is such that the ribs cannot be visualized. Hypervitaminosis D is occasionally seen in reptiles and is generally associated with overzealous vitamin supplementation and subsequent soft tissue mineralization. It can be seen concurrently with renal disease. And again, associated with metastatic mineralization that can be detected radiographically in the aorta. It can be detected grossly in the aorta or in the kidneys and can be associated with pulmonary mineralization in the iguana with subsequent pulmonary hemorrhage. Hypovitaminosis A is common in reptiles, especially aquatic chelonians that are on lettuce and meat diets. It is associated with swollen eyelids and squamous metaplasia of the mucous membranes. Hyperkeratosis occurs in the beak and nails. Typically, affected turtles may form abscesses in the ears due to squamous metaplasia of the mucosa lining the ear canal. Beak overgrowth, nail elongation and deformation, and fractures and secondary infections of the nail beds are somewhat common. Hypervitaminosis A is seen in chelonians and is an iatrogenic event associated with injection of vitamin formulations that contain fat-soluble vitamins. This disease is not seen so much anymore because clinicians are aware of the sensitivity of chelonians to hypervitaminosis A. Those animals with hypervitaminosis A have epidermal necrosis and skin sloughing, which is often fatal. This is the gross appearance of the sloughed skin off a box turtle that has received too many injections of vitamin A. Note the sloughing of the skin from the tail and from the legs. This is a Chaco tortoise with hypervitaminosis A, and note the sloughing of the skin in the neck region and in the axillary region, which was fatal. Histologically, hypervitaminosis A is associated with necrosis of the epidermis and subsequent inflammation in the dermis. Bacterial septicemia is the general cause of death in these cases. Steatitis, probably due to hypovitaminosis E, is common in carnivorous lizards and snakes, especially obese patients. It is believed to be associated with feeding rancid rats and may also be exacerbated by stress. Myocardial and skeletal muscle mineralization and necrosis are occasionally seen as well. This Savannah monitor has fat necrosis associated with hypovitaminosis E. Note the marked discoloration on the cut surface of this fat body. Also note the extensive necrosis in this fat body, a higher magnification showing the necrosis within the fat. Goiter is frequently diagnosed in reptiles, but I believe that this should be interpreted conservatively. There is considerable morphologic alteration in the thyroid glands of reptiles that is based on the season. The thyroid gland is located right at the bifurcation of the great vessels exiting the heart. It is an amber follicular structure in reptiles that is generally solitary. Occasionally there are two lobes of the gland that are connected by an isthmus, but in most cases it is a solitary structure right at the base of the heart, not to be construed as a lesion. This image of the thyroid gland reveals some hypertrophy of the follicular epithelium and alterations and variations rather in the size of the follicular lumina. This illustration also shows marked follicular distension with colloid and flattening of the epithelial cells. But these are considered normal variations in thyroid morphology that should not be interpreted as a disease condition. Occasionally we do see significant alterations in the follicular lumina in which the lumina are reduced in diameter, the follicular epithelium is hypertrophied, and there's a disruption in the normal thyroid organization. These cases may be associated with metabolic derangements due to iodine deficiency, iodine excess, or exposure to goiterogenic substances. A condition that has recently been described in giant tortoises is Thymic Hyperplasia, an intermittent condition of unknown etiology that occurs in giant tortoises and manifests as enlargements at the thoracic inlet on the ventral aspect of the cervical soft tissues. We'll begin with Non-Infectious Diseases, Part 3, Neoplasia. Neoplasia is common in snakes, lizards, and amphibians. It is uncommon, with one exception, in chelonians, and it is rare in crocodilians. Common snake neoplasms include lymphoma, cutaneous and oral squamous cell carcinomas, cutaneous soft tissue sarcomas, and malignancies of the reproductive tract and kidney. Colubrids are prone to colonic and distal small intestinal adenocarcinomas and chondrosarcomas involving the vertebral column. San Francisco garter snakes and other colubrid snakes such as bull snakes are somewhat prone to developing cutaneous melanomas. Pythons are prone to developing oral fibrosarcomas, and retrovirus particles have been seen in these tumors. Soft tissue sarcomas of the body wall are common in all snakes. Oral manifestations of fibrosarcoma in a python. Note the white proliferative tissue that's causing displacement of the glottis. Higher magnification of the fibrosarcoma in this python. Squamous cell carcinoma occurring in the oral cavity of a python, and a oral manifestation of lymphoma. Recurrence of a squamous cell carcinoma in the oral cavity of a python following partial surgical excision. Squamous cell carcinomas also occur in the scent glands of snakes, particularly those in which there is chronic irritation or a history of impactions. Note the marked swelling in the region of the cloaca of this anaconda, and an attempt to resect this tumor from the pericloacal soft tissues. Normal morphology of the scent gland, that of stratified squamous epithelium lining a lumen containing secretory material. In those cases of transformation to squamous cell carcinoma, the secretory secretions usually become inspissated and occasionally colonized by bacteria and fungi, and there's transformation of the epithelium to squamous cell carcinoma, typical cords and squamous pearls that extend into the underlying submucosa or surrounding soft tissues and associated with a scurus response. Lymphoid malignancies are common in snakes. The oral manifestation of lymphoma is also common and frequently misconstrued as necrotic stomatitis. Cutaneous manifestations of lymphoma are also common. However, it's important to emphasize that snakes with oral manifestations of lymphoma or cutaneous manifestations generally also have visceral lymphoma, because lymphoma is a multicentric disease process. Here, an oral manifestation of lymphoma is depicted in the mandibular dental arcades of a snake. Note the asymmetrical swelling of the choanal slit, disruption of the architecture of the inner and outer dental arcades, and even some ulceration in the mucosa. This condition is easily misconstrued as necrotizing stomatitis. Also, note a focus of ulceration and hemorrhage in the oral mucous membrane of a lizard with lymphoma. Marked hepatomegaly associated with lymphoid lymphoma. Splenomegaly with coalescing nodules of lymphoid malignancy. Marked thickening of the gut due to neoplastic lymphoid infiltrates, and marked mucosal thickening. This can be easily misconstrued as amoebiasis or salmonellosis. Typical histologic appearance, though: sheets of neoplastic lymphoid cells here in the skin, here in the interstitium of the lung, here in the bone marrow, and a high magnification view showing the anaplastic lymphoid cells. Ovarian neoplasia, or neoplasia of the reproductive tract, is very common in snakes. And any external mass, or mass that is apparent externally in the caudal third of the body, should warrant a differential diagnosis that includes neoplasia of the reproductive tract. Note the marked swelling here of the body in the distal third, corresponding to a tumor in the ovary. These tumors are aggressive with considerable potential for local tissue invasion and metastasis. Note bilateral seminomas in the testicles of a male snake. Note fibropapillomas on the flippers of this sea turtle. A intussusception is present in the distal small intestine and colon of this king snake, and when the intussusception is reduced at necropsy, a large mass is noted in the wall of the intestine. This is typical of the intestinal or colonic adenocarcinomas that are commonly seen in colubrid snakes, particularly king snakes. These tumors are invasive and readily metastasize. Note the metastatic foci within the liver, kidney, note the marked swelling in the extreme distal third of the body in this king snake. Swellings in this area should clue the clinician or pathologist to a possible renal tumor. In this case, a renal adenocarcinoma. These tumors are common in colubrid snakes. They are not particularly aggressive tumors. They are generally well differentiated and often associated with urate deposits within and adjacent to the tumor. Because these tumors are slow to metastasize, complete surgical excision is often curative. Chondrosarcomas are unique tumors that are frequently seen in corn snakes. These tumors are solitary tumors arising in the vertebral bodies, usually in the articular facets, that become invasive and are associated with pathologic fracture. Cutaneous melanomas are occasionally seen in snakes, particularly in the colorful colubrid snakes such as San Francisco garter snakes. These tumors are generally black on their external surface and dark brown or black on their cut surface, and are infiltrative tumors that are slow to metastasize. They are generally well differentiated. This is a chameleon with a tumor arising from the iris, a melanoma arising from the iris. Miscellaneous neoplasms of importance in reptiles are the lymphoid malignancies in lizards, which are occasionally cluster cases that involve multiple animals, suggesting an infectious or toxic etiology, and the nerve sheath tumors that occur in lizards. The nerve sheath tumors are important because they have more aggressive biological behavior than that seen in mammals. Typically, the nerve sheath tumors in the reptiles are aggressive tumors with considerable potential for local tissue invasion and metastasis. Chelonians only rarely get neoplasms, with the exception of the fibropapillomas in green turtles associated with herpes virus infection. Lymphoid malignancies are occasionally seen in chelonians. Bilateral tear gland adenomas are occasionally seen in iguanas and in chameleons. Hepatomas are occasionally seen in the liver of a variety of reptiles. Here in lizards, here in a snake, and in an iguana, a different kind of neoplasm that has been documented a few times is a malignant vascular neoplasm that seems to arise in the liver, but is slow to metastasize. This is the gross appearance of the nerve sheath tumors seen in lizards. Note marks in this particular case involving the leg. Note the marked swelling, and on cut surface a mottled, variably necrotic tan mass. This is the gross appearance of a lymphoid malignancy in the mucosa of the intestine in a tortoise, courtesy of Dr. Mary Duncan. Note the pseudomembrane forming over the necrotic surfaces of the gut due to secondary bacterial infection. Note the marked proliferative change occurring within the mucosa due to the tumor infiltrate. Foci of white discoloration throughout the hepatic parenchyma and throughout the epicardium and myocardium of the heart due to a lymphoid malignancy in a tortoise. Trauma is a very common cause for diseases in reptiles. Conspecific and penmate trauma, predators, exhibit entrapment due to poor design, and burns. Burns are particularly common. Now, a manifestation of trauma in reptiles is the changes that occur in adrenals due to stress. The interrenal cells, which correspond to the cortical cells of mammals, become hypertrophied and markedly vacuolated in reptiles that are enduring some degree of stress. The reptile spleen also has a stress response, characterized by lymphoid depletion. In this case, severe lymphoid depletion. In this case, moderate lymphoid depletion, and in this case, mild lymphoid depletion. Here, a Komodo dragon with damage to the tongue due to penmate aggression. Loss of toes is common due to penmate aggression, particularly in the crocodilians. Large hematoma formation occurring within the neck region of a bearded dragon due to trauma. Rubbing of the nose due to inadequate exhibit design or maladaptation in an iguana. Abscesses forming in the mouth of an iguana as a result of trauma due to striking at glass or chewing on inanimate objects. Erosions and ulceration of the lips due to rubbing of the lips on the glass walls of a exhibit. Nodular proliferations of the gingiva, presumably due to trauma in an iguana. Methods by which trauma occurs in the oral cavity of snakes and subsequently leads to necrotic stomatitis. Use of tongue depressors as a speculum to open the mouth causes fractures of the teeth and abradement of the mucous membranes. Venipuncture can cause hematomas that are ideal for bacterial colonization. Inducing a snake to strike at an inanimate object such as a toe, or rather a foot, I should say, a shoe, or a stick can cause trauma to the oral cavity and subsequent stomatitis. These are burns occurring along the surfaces of the shell in a turtle that could not get out from under a heat lamp due to faulty exhibit design. Note the extensive burning of the skin of the neck. These are burns on the ventral aspect of an iguana from a heat lamp, or rather from a hot rock. These are from a heat lamp. Various stages. This is a more acute stage. These are healing stages of burns. These are burns on the dorsal aspect of a snake. The snake's emaciated, has other disease processes, and could not get out from under its heat source. Subsequent burns in the skin and sloughing of the skin. Other forms of trauma that are seen include entrapment in man-made or human devices such as monofilament fishing line, fishing nets, ingested hooks, sharks and propellers induce a great deal of trauma in the aquatic chelonians. These are rat bites on the dorsal aspect of a snake that was fed live rats when it wasn't hungry, and the rat predated on the snake. These are some healed rat bites occurring on the dorsal aspect of a snake. These are rat bites or rodent predation occurring on the dorsal aspects of the front legs in a box turtle that shared an exhibit with a rodent. This is cricket predation in a gecko. Note the tip of the tail has been gnawed off by crickets that were placed in the exhibit as a food source for the gecko. This gecko also had hepatic lipidosis. Dog attacks are common in chelonians in particular that are kept in yards, or dog attacks that occur in the wild populations. Note the fractures in the shell associated with a dog attack in this turtle. Ingestion of substrate is somewhat common in reptiles and amphibians. If they're on a rock substrate, it's not uncommon for them to ingest a number of rocks. When they're small, they can pass, but when they're large, they can cause obstruction. Toxins occasionally are a problem in reptiles. Fenbendazole toxicosis, oxygen toxicosis, ivermectin should not be used in some reptiles, particularly chelonians and crocodilians. Organophosphates from pest strips can cause toxicosis in reptiles, and envenomation from conspecifics or penmates is another form of intoxication that is seen in reptiles. Fenbendazole is toxic in mammals, birds, and reptiles when used in inappropriate doses or at inappropriate dose intervals. The lesion is a radiomimetic lesion, so it involves it causes necrosis of rapidly dividing cells in the intestine and bone marrow, and secondary septicemia. Empirical doses of fenbendazole may not be appropriate for all species, and this applies to reptiles as well. Recently, there was a loss of a collection of phase vipers due to fenbendazole intoxication. Normal mucosa of the intestine of snakes is depicted in this illustration. They do not have crypts, just villi, and cells proliferate at all levels of the villus outward. So the basal cells of the mucosa are analogous to the mammalian crypt. So when there's a radiomimetic lesion, necrosis will occur all along the villus, not just in the crypt, as seen with parvovirus or radiation therapy or chemotherapy in a mammal. The fenbendazole toxicosis causes severe necrosis along the mucosal surfaces of the villi. Note the denudation of the mucosal epithelium and the marked congestion in the mucosal blood vessels. Here there is marked loss of epithelial cells along the mucosal surface, marked hemorrhage within the mucosa. Again, the normal structure of the villi and the appearance of severe necrosis with villar collapse due to this radiomimetic change occurring in the intestine due to fenbendazole toxicosis. This image shows some sloughing of necrotic epithelium on one villus juxtaposed to a villus where there has already been sloughing and now there is some regeneration beginning to occur. Fenbendazole toxicosis can also be associated with necrosis of bone marrow. Note the individual necrotic cells in the myeloid series. Oxygen toxicosis, or so-called gas bubble disease, is common in amphibians, but also occasionally occurs in turtles and possibly in crocodilians. It's usually associated with supersaturation of the aquatic environment because of oxygen pump problems. Large vesicles form in the skin and subcutis of affected turtles. Higher magnification of these large vesicles, which are filled with gas or air, and the air can be aspirated from these with a syringe. These will eventually rupture, and the subsequent ulcer may become secondarily infected by bacteria. Microscopic appearance of the gas emboli in the lymphatic channels of the dermis, as well as in the epidermis. Occasionally, these lymphatics will rupture, inciting an inflammatory response in the surrounding dermis to the escaping lymphatic fluid. Organophosphate toxicosis is occasionally seen in reptiles. Apparently, they are very sensitive to the effects of organophosphates and will develop central nervous system signs and hypersalivation. Also, bilateral otitis interna in wild box turtles has been associated with exposure to high levels of organophosphates and accumulation of organophosphates in the liver. Presumably, this accumulation interferes with vitamin A metabolism and results in squamous metaplasia in the ear canals and subsequent abscess formation. This is the appearance of one of these turtles with high levels of organophosphates in the liver and abscesses in the ears. Hypervitaminosis A is an iatrogenic disease associated with injections of vitamin A. Turtles are exquisitely sensitive to the effects of hypervitaminosis A, and before doses were well regulated, these animals unfortunately developed hypervitaminosis A, and the result was necrosis of the epidermis and sloughing of the epidermis, and in some cases was fatal. Ivermectin toxicosis occurs in chelonians and possibly in crocodilians, and is associated with central nervous system depression and paralysis of the respiratory muscles. The mechanism for this is unknown, and there are no gross or microscopic lesions associated with this disease other than the fact that they are paralyzed or lethargic following administration of ivermectin. Reproductive disorders are common in reptiles, particularly prolapsed reproductive tracts associated with dystocia and egg binding. Ectopic eggs are occasionally seen in conjunction with yolk coelomitis, and fatal yolk embolism is commonly seen in animals that have some form of inflammation or degeneration in the ovarian follicles. Bacterial infections involving the ovarian follicles are also common, as the yolk material appears to be an excellent medium for the growth of bacteria. Neoplasia involving the reproductive tract is also common, particularly in snakes. Cloacal oviduct prolapse can occur during normal parturition, in which case it is easily reduced or will reduce on its own, or can be iatrogenic. Acute mild prolapse is easily reduced. Chronic prolapse is a problem due to secondary bacterial and fungal infection and may require amputation of the prolapsed material. Prolapse of the reproductive tract in a turtle. Prolapse of the cloaca in an iguana. Prolapse of the cloaca in a gecko. Hemipene or penile prolapse is also occasionally seen, possibly due to trauma during eversion for copulation. The swelling inhibits retraction and exacerbates the lesion due to repeated episodes of trauma, and secondary bacterial infections become a problem. Amputation is often necessary, and amputation of the hemipene will not obstruct urate flow because urates empty directly into the cloaca. This is a penile prolapse in a alligator. This is a penile prolapse in a iguana, and here is a prolapse in the alligator. secondary trauma associated with prolapse from conspecific aggression is a common sequel. Dystocia is very common, particularly in snakes, chelonians, and lizards. It can be obstructive due to anatomic abnormalities, particularly maternal abnormalities associated with previous episodes of metabolic bone disease in which the pelvis did not grow in proportion with the rest of the body. And fetal abnormalities can result in obstructions as well, either developmental anomalies or mummification of the fetus. Non-obstructive dystocias occur due to inappropriate husbandry, nest site problems, temperature or nutrition, either emaciation or obesity. And dystocia often results in bacterial ooferitis and sepsis. Marked distension of the caudal aspect of the body wall in a boid due to obstruction by eggs in the reproductive tract. Radiographic appearance of the eggs in the reproductive tract of an obstructed python. An obstructed iguana, marked coelomic distension. Note the narrowing of the pelvic canal. This is an animal that had a previous episode of metabolic bone disease but survived it. This would require ovariohysterectomy. Dystocia and mummification is occasionally seen in the viviparous species due to fetal death in utero with subsequent mummification. Again, the dam is prone to sepsis, and these carcasses should be removed as quickly as possible. Radiographs are helpful in the diagnosis of mummification. Pre-ovulatory folliculostasis is occasionally seen, particularly in iguanas, and the cause for this process is not known, but it involves retention or arrest of the pre-ovulatory follicles. Retrograde expulsion of the follicles and subsequent yolk coelomitis occur. Bacterial ooferitis is very common in this condition, and although it's common in lizards, it's also occasionally seen in tortoises and snakes. Note the radiographic appearance of the coelomic cavity, soft tissue densities that at surgery are ovarian follicles that have not developed shells. Yolk coelomitis is common, usually due to folliculostasis and retrograde expulsion of the yolks into the coelomic cavity, but also sometimes due to coelomic trauma or bacterial infections involving the oviduct or ovary. And oftentimes seen with concurrent soft tissue mineralization. This is a monitor lizard with an advanced case of yolk coelomitis. Note the accumulation of yellow granular material or exudative material within the coelomic cavity. Cytologic appearance of yolk material aspirated from the coelomic cavity, globular basophilic material with inflammatory cells. Also can find bacteria sometimes in the cytologic aspirates of these animals with yolk coelomitis. Histologic appearance of the degenerative follicle showing yolk material and a demarcation of inflammatory cells and inflammatory exudate. Again, a colony of bacteria present within the degenerating yolk material. Occasionally, rupture and subsequent coelomic hemorrhage occur within the ovaries of animals that are in active stages of folliculogenesis. And this is generally due to trauma of being handled or falling from a perch or being stepped on or wrestling with another penmate or conspecific. This structure arising from the intestinal wall is a yolk sac, a normal structure, not to be construed as a lesion, and common in young animals. There are some diseases of undetermined etiology that we do not know much about, and these include megacolon in monitors, hypertrophic osteopathy in lizards, dysectasis in snakes and lizards, proliferative osteoarthropathy in iguanas, and proliferative shell disease in turtles. Megacolon is typically seen in savanna monitors and associated with a markedly distended colon and constipation. Secondary colitis may occur. These animals present with marked abdominal enlargement. Appearance of normal colon, appearance of a markedly enlarged colon in a savanna monitor. Note the marked distension of the colon at surgery. May progress to necrosis and inflammation in the colon. Dysectasis is seen in snakes and lizards and can be congenital, environmental, or metabolic, and it implies a failure to shed uniformly and frequently associated with secondary infections, particularly fungal infections, but can also be associated with annular strictures involving the tail or the toe. This is a milk snake with a congenital form of dysectasis, probably a heritable disorder. This is an iguana with annular constrictions of the toes and feet due to dysectasis. This is the tail of an iguana with annular constrictions due to dysectasis, a failure to adequately shed its skin. This is dysectasis in a crocodile lizard. Note the areas of retained shed associated with emaciation and a colilith in the liver. Hypertrophic osteopathy is a disease of undetermined etiology and parallels the same disease seen in mammals, but it's common in lizards, particularly in the long bones, and associated with subperiosteal new bone formation. The joints are spared, and the etiology is undetermined. Typical radiographic appearance of an affected savanna monitor showing proliferative changes along the articular surfaces of the long bones. Gross appearance of the affected bones. Note the sparing of the joints and involvement of the midshaft and metaphyseal regions. Histologic appearance showing well-differentiated, often remodeled bone in the subperiosteal regions arising from the cortex. Oftentimes, there will even be well-differentiated bone marrow. And note the sparing of the joint